Yes, first of all, I want to thank the National Academy of Sciences for letting me to be here. Even though I was a trainee as a family physician at Temple University, over the years my English has gone a little bit rotten. So I would try to do the best I can. I have a couple of slides. My presentation here is going to be more what was my experience as a primary care physician in the mountains in Puerto Rico. So, as you see, Georges and Maria, two hurricanes, the same challenge, is because the experiences I learned from Georges were the same experiences that I used them to help in Maria. So it was a lecture learned. This gives you a demographics and vital statistics of my hometown. As you can see, the estimated population. Something very important here is barrios, 17, and you can see that there's only 66.69 square miles. Even though it's a small municipality, given the rough terrain, in a regular day, it might take 1 hour to go from one side to the other. Just imagine the rubbles and the landslides, how much it takes to get from one place to the other. The second one, Castañer, I was a scholar of the National Institute of Health, and Castañer is a small community hospital, 33-bed, and that's where I was involved with the challenge of Georges. I'm not going to read all this, it's already written, but these are the experiences I learned from there. First of all, that the municipalities are made up of, municipalities are made of barrios, of communities. The communities are called barrios and sectores. Let's say this way, when you have a municipio, that is the political division of Puerto Rico, or Spanish custom, each municipio is divided in barrio, and each barrio has a sector. And the necessities of each sector is different from the ones of the other sector in the same municipality, in the same barrio. Also, it reaffirmed me that the main resource of the community is what defines it, the human resource. And most of all, I learned that in all types of natural disasters, although initially the concerns are about infrastructure, at the end are still a public health issue. Then came Maria. Something that I also learned is that when you live in the mountains, for every 1,000 feet, you have to add 10 miles to whatever hurricane comes at sea level. So if you live where my hometown is 3,925 feet above sea level, so you have to add nearly 39 miles to whatever was the amount of winds that we got in the coastline. So that was day 2. Yes, that's my medical bag. I went to I started visiting around, and it didn't take me long to realize that we have the same challenge that we got during Georges. That was my office. It was a first eco-friendly office in Puerto Rico, natural lighting and crosswind. So, and then I made this map. This is in the best tradition of Dr. Jon Snow. If you see there, it's gonna. This is Adjuntas. This is my hometown, and these are the barrios and different sectors around Adjuntas. This is one of the major towns in Puerto Rico, in the south part of the island, that is Ponce, and this is the area that I know pretty well. This might be the center part of the island, all the way to the close to the coastline in the west. Then I wrote down here, it's translated in the next slide. I wrote down here which one might be, from a health point of view, the challenges that needs to be taken care of. And this was 5 days after the hurricane. So you might have a better idea. In that corner, what we have was, given the rubble and the bottles, we might have then rats and leptospirosis, mongoose and rabies, that are conditions that are endemic in the area. It's an agricultural area. 80% of the economy comes from coffee plantations, bananas, and oranges. Mosquitoes on covered containers and do not stop. Well, it was still raining, so it was dengue, Zika, chikungunya, that already was there. Infection, conjunctivitis, influenza, scabies. Then on the other one, specific needs that need to be taken care of, health services, more education in isolated areas, prevention of mosquito nets, repellents, food in isolated areas, Clorox, baby formula, mass vaccination, proper use of electric generators. The first time that the fire people, the firemen came out of town to help a given place was because the guy was putting gas in a power generator when it was on. Water filters. And then the last one, handling of and disposal of perishable foods. Something interesting is that rooster fights are a strong thing in the area. So many roosters die and chickens. So how you take rid of that, all that? So that was something that was needed to take care of. Something also very important is this. In the isolated areas, the only way that people can get communication about services and things that were going on was through radio, but there were no batteries. So these people was really isolated. Between the many things that I did, I took this map to every institution in the municipality and local government, and then I invited myself to this coalition of health care of Southern Puerto Rico. There is a coalition of people from all around the island and institutions that came from the states to look out for assistance, to provide this assistance. The problem was that few assistance was provided. The few assistance that got reached to my municipality was in the square of town. Didn't visit the barrios and sectores. So there was not outreach to these areas where there was the real necessity. So of all these, only 2 came forward. So I make a schedule of 6-point plan, workshops, give strength to the health center, access, supplies, mental health, physical health. Of course, the old way, chalk, blackboard, piece of paper, and pen. It works. Healthcare, our health center still today doesn't have a sanitary license. So, and the one who provides to my office the sanitary license is in there. Unbelievable. Actually, the other thing is there was the local health department only provided to them 5 suture kits for the hurricane. So I got in contact with a good friend of mine in Texas, and she sent me $20,000 in medical equipment to equip our ER there. And it was amazing. So then access. These guys were veterans from the Afghanistan war, and they did pretty well. They opened access to people who were nearly 5 or 4 weeks still without getting any access to the main roads, and they did wonderful. Supplies, this is a guy who got a business. He was hit really hard, but he's as big as his heart, and he really took care of this. What we did with all this is that we given that I know my community, I knew which one were the leaders of each one of these sectors. For example, if most of these communities have their own water programs, they have a president who takes care of the community water supply. So who better than him knows which one are the best necessities of these people? When the schools start, not students, but when they open the schools, the teachers were an excellent source because they're a microcosm of the whole community. And that's the way we reach. And we reach house by house by house, in making an impact on the real necessities of each one of these places that I showed you in the beginning. Mental health, that was from the Medical School of Medicine. This was one of the institutions that in that coalition that I showed you before that came forward. And they did great. You know that mental health is a taboo anywhere. So what they did, they have this social service assistant. Then they have let's say this way. Then goes a social worker, a psychologist, and then the doctor, and they give you the water at the end. So the people make the line just to get the water. But they came back to the psychologist, and what they said, thank you for listening to me. So that was the way they took reach of the people from the healthcare point of mental health point of view. And then AmeriCares, and these people did an incredible job. We make an asset of house by house, sector by sector, and it was incredible the difference that they made in the area. So this is more or less the way we handle the situation there. It was a community-based approach. And it gave another lecture, of course, that is up to the communities and to the real leaders to provide the assistance that is needed during these kind of disasters. One point is, sometimes the help goes just to the town, to the square of the town. It's an example here. Just there. That was it. Okay. So it's a matter of making the real outreach then. So for an end, this is something that is, that's the reason for that. That's the difference between survival and resilience. A patient of mine came to my office in November when there was still no power, there was nothing at all. He came, he was unable to pay, there was no issue at all. I'm a country doctor, I treat from 1 to 10. And the point is that he said to me, "Doctor, I got some plantains in my house. Once it grows, I will bring it to you." So I said, yes, after this hurricane, and let me tell you, the hurricane in Adjuntas, where I live, the winds were up to 200 miles per hour. So that's a category 5. And the wind gusts were 220, and that's an F4 tornado, okay? And that was sustained multiple times. So in January, as you can see already there was power in my office. He said to me, "Doctor, come by, I have the plantains for you." I said, well, when he showed me this, I need to get an escort from the police department to get into my office. And, but this teaches you something, that this tree survived the hurricane, that's survival. That this fruit came over and grow this side, that's resilience. So thank you.
Thank you.